Kevin's up there and he won't hear you if you don't have your mic on. So it is now 10:30, so I'd like to call the meeting to order. And Laura, would you start on your end as just introduce who you are to the group, and we're just going to go all the way around. It's not like you have a report, it's just remembering who you are.
I thought you were making me start like all with my little report right away this morning.
Not right away.
I'm Laura Boyer. I'm one of the ADRC specialists here at the Aging and Disability Resource Center.
Colleen Schwarke from ASIO.
Rachel Herman from Pleasantville, volunteer.
Phyllis Olson from Blair.
Beth Killian, Arcadia.
Jeannie Nutter, Trempealeau County Board Supervisor, District 16, and I'm on this committee as part of Human Services, or DHSS. I gotta get used to that.
Dawn Waldera, Supervisor for District 11.
I'm Scott Brown from the Whitehall area.
I'm Kevin Adams, Trempealeau County Supervisor. I'm also on the HHS board. That's going to be taking some getting used to too.
Mary Beck from Whitehall.
Heidi McKeith from Galesville.
George Brandt from French Creek, Ettrick Township.
Jay Hine, Department of Health and Human Services Director.
Joan Sasala from Independence.
Rebecca Rick, ADRC Admin.
Wonderful, thank you very much. We appreciate getting to know everybody. We used to have signs that were, right in front of our microphones, and that was great for me because one of my weaknesses in my whole life has been not remembering names. So I apologize if I get your names wrong at this point, but welcome Heidi and George. You're some of our newest members, and we really appreciate you coming. Everybody has some idea, some good things to present to a committee, and we're just looking to. We don't vote on the stuff that we discuss here. It's moved on to the Health and Human Services Board, and then they do the voting. I also am a member of the Health and Human Services Board of Directors, so I get to sit here and do this and then go there and listen there, and Jay repeats himself here and there. And no, it's not repeating yourself. It's giving the good information of what's going on. And I think this ADRC has a tremendous reputation in the whole state of Wisconsin. There's a lot that goes on, and lots of good statistics, and people love what's happening for them and with them and around them and whatever. So it's really good. So I'd like to call the meeting to order. The open meeting law has been met through the proper posting. We have an agenda in front of us. I'd entertain a motion to approve our agenda.
I so move.
I'll second.
Okay. Any discussion on the agenda? I don't think I didn't ask if there were any additional items, but all in favor of approving the agenda, say aye.
Aye.
Opposed, same sign. Okay. Minutes of the previous meeting, June 3rd. If you've had a chance to review those, I'd entertain a motion to approve the minutes from June 3rd.
I want to make a comment, though, first. I was at the meeting and my name wasn't listed, and I wasn't absent, so just, I was, it's no big deal, but.
It's the name thing.
Yeah.
Thank you.
Yep.
I'll second.
Okay, it's been moved and seconded to approve the minutes from June 3rd. All in favor say aye.
Aye.
Opposed, same sign. Motion carries. And we move to number 6, Advisory Council Membership and Mileage Reimbursement Option. Jay, is that you?
It is, yeah. Oh, thank you. Darn it, I'm usually good about that. All right. Okay, so a couple of things that Melissa wanted me to cover. One was that Heidi was going to be joining us today, and she's from Galesville and has expressed interest in serving on the council. And so if If she confirms that with me today, then we will take your name to the Health and Human Services Board for their approval. And then, and actually, first of all, I'll talk with Becky Gluen, our county administrator, and then we'll take it to the board, and I'm sure she'll be fine with that for the more formal approval process too. So, yeah. So that was one item. And then the second is that Melissa wanted me to remind folks that council members can be reimbursed for your travel to and from meetings at our federal rate of 70 cents a mile. If you'd like to request reimbursement, please complete a mileage form and return it to either Melissa when she's here or to Becky as well. And I do have a number of sheets with me that I can pass out before we leave today too. So if you'd like one of those, I'll certainly have those for you. So those were the two items that I was covering under that.
Sounds good. Any questions? Okay, Falls Prevention Month activities.
Again, that is me. You're gonna get sick of hearing me pretty soon.
Today you get a real appreciation of what Melissa does.
Believe me, I have an appreciation every day because I've helped her out a few times with the boots on the ground, events and things like that. And, I am on. And so, yeah, I definitely appreciate Melissa and all of the staff. So I know you guys do a great job. Okay, so September is Falls Prevention Month, and one of the goals in the aging plan is to shine a spotlight on falls prevention, reducing falls in our community, especially among older adults. So some of the things that, and we've made a lot of strides over the past year. We've joined the Falls Free Wisconsin Coalition, connecting us with the statewide resources and support. And then this fall, this ADRC staff are going to start training to become certified leaders in the evidence-based Stepping On Falls Prevention Program. So that's a major effort in offering some evidence-based falls prevention strategies, and right here in our community, in our county as well. So the next ADRC newsletter is going to be dedicated to Falls Prevention Month, and actually I think she has that in my door right now for me to look over and review. And that's going to include some educational content on falls prevention, activity details of what we have going on, and then practical tips for reducing your falls risk as well in homes and your living environment. So we are also launching Falls Prevention Bingo Challenge, and so that's where participants will complete falls safety tasks, say that 3 times, and those who finish the card can win prizes. So there's kind of an incentive there. And then the last thing that we've got going on as well is we're distributing practical giveaways like night lights and things like that at the ADRC and at our senior congregate meal sites to help make folks' homes safer. So, and this is, as I said, this is part of our aging plan, and it fits very well with the September initiative to kind of, every month that we have something like that where it's promoting awareness, it's taking steps, to make sure that we're addressing some of those risks that people have in their homes that they might not even think about at times, so we're, as you said, Scott, our ADRC is really proactive and really good about keeping these things in front of folks. So that is all I have to say about that. Any questions at all about any of those things?
I don't have any questions, but I was just going to say that we are always looking for people that would potentially want to become certified as trainers for these programs. So getting ready to spearhead the Stepping On program, but we have done the Strong Bodies program throughout Trempealeau County, and we've had some really strong participation throughout many areas of the county. But always looking for leaders who are interested in becoming certified. The ADRC will pay for the training. And we've had really good turnout at these programs that we've had. And the whole idea is just what Jay was saying, trying to get people to age well and falls prevention.
Hey, Scott.
Yes, George.
I apologize. I actually know better than this, but since this is somewhat less formal than a county board meeting, I'm going to ask to go back to the previous item on the agenda, if that's okay?
Sure.
So this is addressed to the ADRC staff, and I, again, am not trying to like load you up with work or anything, but for over 2 decades, I was filling out forms to, for mileage and per diem on the county board, and you know what? I had to have help every single time. I could just never figure out what, where does that go? What are we multiplying things by? Where am I supposed to sign? That sort of thing. On the Environment and Land Use Committee, we had a number of citizen members. And what the staff would do was find out what their mileage was and have the form filled out with the exception of the signature. And
Did Verge do that?
what?
Did
Verge would do that, yeah. And I mean, I was doing it for 20 years and I could never remember how to do it and who to give it to and when to bring it along and things like that. Can I suggest to the ADRC staff that perhaps they would get the names of all the members and then just have their, find out what the mileage is and then just have the signature line open for the meeting time.
And just have you verify.
Just verify we are here and we drove this mile.
Yeah, I don't think that's a problem, yeah.
Okay.
That might all change if it's all on computerized.
That is true. Once
In a
we get our
couple months.
electronic system,
It'll be
we'll have to
done
figure out how that
electronically.
gets. But we could still, I think there might still be an option, and I think we've talked about this with the clerk's office, where we could have, as you were saying, have you submit, like, here, or just let us know what your mileage is, and then maybe have our staff even enter it into the system for you. And so I'll see what kind of.
Check with Stacy and see if the
Yeah.
citizen members are
She's the
gonna
one
be
who
online.
we've been talking about, just,
Yeah.
I don't think she's quite sure yet what the, with that new system, what it's gonna look like
Okay.
and how do we get that set up, but that was her thought too, is maybe we would just be entering
Yeah.
some of that information for folks,
Okay.
so.
And I would just remind everybody that maybe I'm the only person left in the world who does not use computers,
Oh, my God.
but, Jeannie, are you suggesting that is the case? I couldn't even
I
find.
can help you. I'm really good at helping
I
my
don't want
old
help.
friends
Even
fill
when
out forms and
Even when I
fix
had
their
a computer, I couldn't
computers.
find my email. So, this is, yeah.
We might want to rethink George on this committee.
I was just thinking the same thing. He's
So-
painting himself into a
So how
corner.
is it that an aging and disability committee expects everybody to know how to use computers?
Well,
Or
we
to
try
have
to help.
access to
We
computers?
used to have that, computer cafe or something where people, this maybe was before your time. We had.
I think it was called Sip and Swipe.
Yep. Thank you. We had iPads and,
Oh, okay.
anyway. But I would really be happy to go back to that and be technical assistance for elderly who can't figure it
So you're
out.
volunteering to deliver a
Yes.
program for us, is what you're
Yeah,
saying?
I'm very,
To re-implement Sip and Swipe. It was a fun
yeah,
fun
you remember
course.
that,
Yep,
don't you?
I do, yes.
Yeah.
Yep.
All
Yeah.
kidding aside, I do,
That helps.
I think we'll be able to accommodate folks,
Okay.
yeah.
So maybe spend a little time finding out what people's mileage are.
Yep.
Yeah.
Yep.
It's true.
That sounds good. Okay. Any other questions about falls prevention?
Thank you, Scott, for letting me do that.
You're welcome.
I got so distracted by George. What month is Falls Prevention Month?
September.
Okay.
Coming up, we're trying to get ahead of the game.
Yeah.
Yeah, cool.
Yeah, summer's gone so fast. September will be here before we know it.
Don't say that yet. It's only the 5th of August.
Okay, take back what I just said. Becky, strike that from the record. Okay, ADRC program spotlight. Is this, Laura, where you're jumping in some of that, or?
This is Laura.
This
Okay.
is
We should have a drum roll or
Laura.
something, yeah.
So, not always knowing how much the ADRC Advisory Council knows about just all the different segments of the ADRC. So Melissa asked if I would come this morning and just share some information with you guys about what the role of the ADRC specialists are. So there are 3 of us who are ADRC specialists at the ADRC. And our role, we're all licensed certified social workers, and our role is to really work with the aging and disabled population of Trempealeau County to try to connect them to resources that can help them age well and as independently as possible. We were just talking at our meeting on Monday about how the aging population, how it's growing exponentially, and resources are not always out there, right? So trying to get creative with what some of those resources might look like. We have the ability to go into people's homes and provide what we call options counseling with people, and sometimes if people have the ability to pay for services out of their own pocket, we will give them information about resources that could potentially help them in the home that they would pay for out of their own pocket. Those resources might look like life alerts. It could look like connecting them to information about RAMP services, home care agencies that could assist them, transportation programs, the home delivered meal programs, caregiver programs, such like that. Other information that we provide to people is information about Medicaid-funded programs like family care and IRIS programs. And sometimes people already have that Medicaid source, and sometimes they don't. And when they don't, then it's also part of our role to try to assist people with those Medicaid applications and trying to get that, that source set up for them. Medicaid, as you may or may not be aware, is like a really big topic in the news these days. There's lots of changes maybe that are coming. A lot of it is just, we don't know what's going to happen. There's lots of scenarios that they keep talking about. This really makes our job interesting. We've had lots of calls from people afraid that there is going to be changes with Medicaid. What does that mean? Like, my mom's got Medicaid paying for her nursing home stay. Are they going to not pay for her nursing home stay anymore? What about my parents who are enrolled with a family care program, and this family care program comes in every day and provides so many hours of help to my mom or dad in their home? Is this Medicaid, these changes with the Medicaid, going to affect their funding source for these services? And unfortunately, we don't have answers to any of that. The state guidance that we've had is fairly unclear yet too. We don't, we just try to reassure people that, for now their services are all okay. And I mean, I hope that it doesn't change where we aren't going to be paying for people's stays in the nursing home and such things like that. But some of the things that we've heard is that right now Medicaid application renewals are occurring annually. And this has been difficult for people. We see a lot of people losing their Medicaid sources because sometimes those Medicaid renewals are really difficult and people don't understand the language that's in the letters that they receive. So we at the ADRC spend a fair amount of time assisting people with Medicaid renewals. If these renewals aren't done in a timely fashion, people are losing their services through family care and IRIS programs. They're losing their Medicaid to pay for their institutional care at the nursing home. So as you can about imagine, sometimes the cases that we receive are fairly frantic and they're looking for assistance as soon as possible. We've seen sort of an increase, just like in the last month or so, in referrals for homeless people or potentially homeless people, people who are living in subsidized housing and are not managing well financially. They don't have enough money to pay their rent and their utilities, aren't having enough money for food, and so then when that occurs, what ends up getting eliminated is the rent. You know, so people, just seeing an increase in people who are either unhoused or at threat of being unhoused. Lots of people looking for financial resources too. It seems like people like, you know, I don't know if it's the economic times that we're in right now. Prices of things have gone up, and people who are receiving disability income or just living on their limited Social Security income are struggling more with paying their bills and making ends meet. So just getting a fair amount of calls for people just looking for financial resources. And sometimes we have resource information for them, and sometimes we don't. There's not always a ton of information for us to share with people, but these are sort of some of the cases that we're seeing in the last month or two of just people, and we're talking about elderly and disabled people who are just like finding themselves sort of in a tough spot. I've talked about the Medicaid changes. You know, we don't know what that's going to look like. It's got a lot of people nervous about, you know, what their future looks like. And, you know, unfortunately, we haven't really been able to provide a lot of reassurance for them because we don't know what that political atmosphere looks like either. So we just keep doing the best that we can, trying to support people where they're at in their situations, and giving them the information that we can to try to improve their situations if we can. The only other thing that I wanted to say was we, as you guys know, last fall we all of us ADRC workers moved into the courthouse into the area that we're in, and we've received a fair amount of feedback from people, some people who come to the courthouse, that the walking distance from the parking lot to get to the Human Services window is a lot. So we ADRC workers have been people texting us when they get to the parking lot, and we run farmers market voucher applications out to them to their car, or they're bringing verifications in, and so they don't have to walk to Human Services. We walk out to the parking lot to meet them. It's just been a real obstacle, and hopefully once the new construction is completed, that will be better for them. We do have concerns about the construction that is coming up, because then it sounds like people are gonna have to enter into the elevator. You go through security, you enter the elevator there, and then ride up to the second floor, and then go down a hallway, ride down the elevator to find Human Services. And we're like, they can't even find us now sometimes. So we did talk to security last week and just said, listen, when people come in, if they've got the deer in the headlights look on their face when you're trying to explain to them where to find us or how to find us, just call us so that we can come out and meet with them and maybe, you know, chaperone them back to our offices. Hopefully this construction business will end soon. I know that there was some notation in the county board meeting that the construction noise is not bothersome, but that is not really the case. There's a lot of noise in our offices, and some days trying to make phone calls when it sounds like you're in a dentist office and the drill is going very loudly, it can be distracting, but I know that people have been doing the best that they can to get through all of this. And the other thing is we do have the option to work remotely if we want to, but I think most people, at least at the ADRC, really prefer to be in the office. There's only one or two of us that works remotely from home. The rest of us prefer to be here and in the office and providing our services here, so.
It's really dusty in the areas I noticed when I went to HR, so people should be warned if they come in, if they have breathing issues, maybe wear a mask or something, because it is very dusty. You can't help it,
I know. Well, and we've just noticed that with our computer screens and computer equipment, that there's just layers of dust on it. So I personally clean mine once a week, but you think about it too, like we're breathing in all of this stuff every day. So it can't be really that great, but, again, hopefully this will be ending soon and we can,
Go back to normal.
yeah.
The pain,
Whatever that is.
just the pain of construction, right? Like,
Right. Everybody goes through it.
yeah. I had a couple of questions, though, related to the distance that the people have to travel to get to your department. Do we have wheelchairs available that they can use? How about like the scooters, like the electric scooters that you just push the button on? Is that available option?
We do not have electric scooters, Dawn, but we do have, there's multiple wheelchairs out at the entrance of the courthouse when you come in.
Well, the difficulty with the wheelchair, of course, is that you're still going to have staff come down then and probably push the person.
Yep, and that is happening.
And that's great. I mean, I appreciate that you're doing that. I just know that the electric scooters, I don't know what the correct terminology is, but their costs has gone down a lot for those, and that would allow for folks to have independent mobility to get to your department. So it might be something to think about having maybe just one of anyway.
And
And it-
honestly, Dawn, when Mark says, do you need a wheelchair? If it's pride or what it is, people most of the time do not want us to come down and push them down to our office in the wheelchair. Maybe if there was a scooter, they might be more willing to use
They could
it.
just independently take it. But you think about it, like Walmart and all the other grocery stores, like they have them, and you see people using them all the time. So it might be an option to think about.
The only thing I would worry about, Jay, is that narrow hallway there between UW Extension. Like, it's a one-man hallway. You
That's
can't
true.
pass anybody in there, and so if
But
somebody
maybe
came...
when the construction is done, that would be a better option. Yeah.
Yeah, because that'll be a nice wider space and everything too.
When you always have the fear of people not knowing how to drive them and crashing into walls and other things too. That's
Yeah.
a common issue.
Nature of the thing. I was gonna say too, we're exploring like how, what other ways we could be more accessible to people especially during the construction before all of that gets, worked out. And one of the things we're talking about is, hey, that I'm trying to explore with maybe Jeremy or the sheriff, hey, is there any space where we could temporarily like have somebody closer to the entrance, so that they don't have to go in and up and over and down and, hey, now you're at the ADRC.
Like, use the Badger room if no one's in there.
Maybe,
or,
yeah, so-
or even just take the elevator up here and meet. It's usually really quiet there outside
Right,
child
yeah.
support and stuff.
Yeah,
We
so-
did
so we'll
talk about
I
that
wanted to
too,
talk about-
Jeannie.
yeah.
Yep, I know during COVID, when the ADRC building was closed, we just had mostly access to the Wisconsin room. That was when the entrance was, yep. But we just when there was walk-ins and things like that, we would just come across the street and just go meet with people in the Wisconsin room. We have talked about that with the Badger room. I'm just not sure how busy that room is.
And we haven't had a chance to talk through that with Jeremy and Brett yet, so. They're open to the conversation. It's just like, how would that work? What if there's an investigation where now they need the Badger room for something and we've, or maybe the sheriff's conference room. I don't know.
Meet at Sweet Temptations and have coffee.
I really like that idea. Yeah.
Not a bad idea.
I figured you would like that, Laura, yes.
Except Wednesdays, sometimes it's really quiet in there in the morning,
Yeah.
or later, when do they
Yeah.
close? Like
2 o'clock.
Well, we've thought about, could we put something up like in that past security in that open area, but like, even if you put up partitions or something like that, it's still really confidential information that we don't want other people hearing too, so, so there's kind of that. So we're seeing if there are other options, otherwise it's we'll go get people and or take things out to them like Laura was saying too. One of the things that I just wanted to chime in with too is that, so and we've just been talking about this recently, when you go back to kind of the Medicaid eligibility and how it's increased, the review is increasing from once a year to twice a year is how it's looking now, and maybe there's some work requirements and things like that too, for some folks. But our economic support folks, since COVID began, have been 100% remote, pretty much, and so they're because a lot of their time is spent on the consortium call center, to take the Medicaid eligibility questions and that kind of thing. And so what we're doing now is we're going to be having a rotation where we're going to have, and our supervisors are Sandy and Dana in the RIA consortium. They're here a decent amount of time. But we're also going to start having a rotation where every single weekday, we're going to have at least one of their staff, economic consortium staff in the building to handle walk-ins and things like that. Because I know the ADRC has been seeing maybe some increased traffic that way, whether it's questions or, hey, I need help with my, eligibility packet, that kind of things. So we'll have more expertise in the building. So having more people sometimes can help, and then maybe that frees us up to be a little bit more attentive to people. I figured you would, yeah. So
But we do joke
just
in
talked
the
about it this
ADRC, we're like,
morning.
we could be economic support workers.
Right? Yes.
Yeah, you could.
Yes.
I have just a little question. Are you seeing an increase in people requesting Meals on Wheels, or an increase at the congregate sites, since it's tough right now out
I
there
don't know that there's
financially
been
for some people?
a change that we've seen that's tied to any recent occurrences.
We just talked about that, Jeannie, at our ADRC meeting, and Melissa said home delivered meal numbers are down slightly.
are, okay.
Congregate meal numbers are up in certain areas.
Oh, good,
like
okay.
Cafe 60 numbers are like super busy.
Over the roof, out of
Right,
the roof, or whatever
right.
that saying
Yep.
is.
And I do have the numbers here that I can share with you.
Through the
too.
roof, thank you.
Find the right preposition.
Yeah, so I don't know that we've seen an increase in
Okay.
any of that kind of stuff
I
just yet.
bet maybe in the future that might happen, because all the changes aren't really taking effect until next year, the cuts and everything, so. Oh,
Right.
it's gonna be tough for people, I'm
Right.
scared.
Well, and that's kind of like what Laura was saying too. We're just kind of, there's a lot of things that are either on the table or being talked about or whatever, and
chaos.
And as you go through, we're going through the budget process right now, obviously, and so as you process through that, we can only address what's right in front of us right
Right,
now,
right.
and so we have to operate unless we've received other information. The things that we have heard about are the eligibility pieces and some of those related. And then from like a health department, the public health area, we've heard about some supplemental funding for like immunizations and things like that going away. Our main funding for that is still intact and everything. But so it's not terribly much yet, and that's like implemented yet. But we're kind of keeping an ear to the ground from national associations and the state and trying to bring those back to Becky as well, and to keep her in the loop, so that, once anything comes down
hard
the
to
pike,
plan
we
when-
want to be ready to jump on it, or to, okay, now what do we need to do? What does this mean for us? What does this mean for the people we're serving? So,
Scott, I have a couple questions. Where to start? So, there were a couple of things you'd mentioned that just always set not alarms, but I love
Triggers.
talking demographics, and the information you're sharing in terms of the rapidly increasing elderly population, and also you're seeing a significant increase in unhoused, is that the term you use? People who are currently have someplace to live, but quite possibly or already have lost that opportunity. That if that's on the rise, as well as folks who are food insecure increasing within the county. And I think, thank you for reminding me that you're in the middle of budget season. Those are the sort of things that the county, I think, should be focusing on, but the question that comes out is, where's your funding from? What part of your funding pie is county, state, federal? At ADRC specifically?
Sure. Yeah, it's hard for me to give you the exact breakdown.
Doesn't have to be exact, generally speaking.
No, I know. And we have a lot of, the reason I hesitate is just because the different, and I almost wish Kelly, our fiscal manager, were here, because at least she could give a more intelligent answer to this.
I got
But yeah.
by being pretending to be intelligent for many years. Just go ahead. You have my permission.
So we have a lot of different pots of money, and I think what we, I believe the congregate meal sites, if we're talking about like the nutrition and the food and things like that.
Well, everything.
Sure,
You know,
sure.
The transportation, the Medicaid stuff, the staff, we know who pays for staff. And so
Right,
forth.
right. So if I had to guess, overall with the ADRC, with the qualifier that whatever I tell you is probably going to not be completely accurate either. So this is my best educated guess, because I do know that we do contribute levy dollars, either as a match or to supplement certain programs.
Okay, that's part of the answer I was looking for.
Yep,
Yeah.
yep. And so some of that's required, obviously, because the state says, hey, we'll put in this much. Now you, county, need to, contribute X amount as well. But I would say my best educated guess would be that we're maybe at 90%, 80 to 90% probably funding for ADRC functions. And the rest of that comes from, I believe, from levy, but I could be wrong. I know Kathy Gauger watches these things sometimes, so she could probably have. She texts you sometimes, Jeannie, so anyway, yeah. But I know those have changed too, even from when Kathy was here as well, so. But actually what I could do, and I feel a little bit irresponsible even giving you a percentage, just because I want to come back with a better number maybe next time around too. But yeah, those are the factors that are kind of some of the sliding things that can change over time, is what kind of county match is required, what funding is actually available, and because we might not have the extra levy funding to supplement that we have to reduce that level of service, which is the unfortunate piece of things, whether it's the funding, or whether it's the, hey, for transportation, for example, we can't find enough volunteers sometimes, to do some of that, and that, there's so many other things that go into that too. How many people are using it? What are the alternatives that they might have that might not be any more expensive than what we would be providing anyway? And so it's very much the cost-benefit analysis as to, okay, do we reduce the level of service? Do we go ask for more levy dollars? What makes sense here? And so those are some of the changes, I think, over the last, especially 2 years probably, that we've seen some things change with that, so. Does that answer your question?
Well,
Because Trempealeau County was a pilot county when the ADRCs were developed, we got a significant more
Yes.
amount of money from the state
Yes.
than other counties did. And I believe that has not changed yet.
Right, and actually, in effect, I'm glad you said that, Jeannie, because I want to say it was towards the end of last year, where they were telling us that that our funding was going to actually be reduced from what it had been. And it was pretty much stagnant for a long time. And what our conversation was with them was, and our state people are really good to work with. They're just giving us the message. And so, but I wanted to process through that with them. And I said, okay, so when we meet, I want to know what your recommendations are for where we can, responsibly reduce levels of service, because I was being told that we did not have additional levy funding. And so that changed the dialogue a little bit. And by the time we met, they said, we're going to keep you whole. We're going to keep you the same. We're not going to reduce, but they were going to reduce us 18%.
That was a lot.
That was just really significant. And
almost
so,
a fifth, yeah.
and so that's why I said, and like I say, they're nice people, but I'm like, I wanted to hold their feet to the fire and say, what are you suggesting then? You know, what, because this is what we have in place. We're already having to do a lot of, you know, volunteer recruitment and look for different resources other than having that funding in place to serve people and to continue the same level of services.
And that was just kind of out of the blue that they were going to do this. But
Yeah.
if I could just jump in here, I think
Yeah. Sorry to interrupt, Jeannie.
a big chunk of our money comes from the state.
It does, yep.
And, you know, Medicaid is funded through the federal government and the state.
So the question is, I mean, it's not unfortunate that you're considering cutting services. It's unconscionable. I mean, in the face of the demographics and the reality on the ground, the idea that someone would try to balance an already incredibly well-balanced budget by cutting services to the elderly and the homeless and the disabled is really unconscionable. And I think members of the county board should hear that. This is not, you don't balance the budget by cutting the services to people who need them the most, especially since, and that's my next question, what are our statutory requirements in terms of providing services?
Yeah, a lot of these we're not, like, the level of service isn't prescribed.
Really?
For a lot of these things, right? So take congregate meals, for example. That's not a prescribed, I mean, there is a minimum, I think, but we're above that at this point for many of our, many of those services. But I also don't want to, I would rather not scale it back to, you know, to be closer to those minimums. I would rather, because I think right now.
Well, then say that.
And I do, yes.
It's like,
yeah, no, I do.
Don't think it.
No, I know.
Say it.
I know. I don't disagree.
Can
yeah.
I just have to say it. I sat in on 24 budget processes in the county board. There was not one year when we didn't have 5 to 10 times more money in the general fund than was recommended, or that we were at a fraction, possibly 10, 12% of what we could borrow in terms of money. So Trempealeau County is not hurting for money. And
That's kind of changed a tiny bit since you
well,
left.
maybe a tiny bit, but even if it were changed
Right.
by double, that would still mean that the county has considerably more money than many other counties of the same size. And the income of the county continues to grow because of the increase in, well, among other things, the increase in property values and so forth. So
We were forced at one time, this was like 5 years ago, to develop a policy for putting people on a waiting list for home-delivered meals in the nutrition program. And
forced by
the state. And the committee at that time did not want to do it. And I said, we're not going to have a waiting list for people to get food. I mean, for me, that was like, you know, I couldn't live with that. But the state came up and they met the people from GWAR, whoever came up and explained to us why we needed to have a policy for what was going to happen if we were going to have a waiting list. We have that policy. Kathy Gauger, I think, was here then, but we have never used it. I mean, I just hope that never happens, that.
The ADRC was, my understanding, from my memory, which is not great.
We're kind of
The
veering way
ADRC
off
system
topic here.
was developed to eliminate, some of you might remember the Unified Board, to eliminate waiting lists. You know, the promise was, this is going to take care of it. There's going to be money, there's going to be providers, there's going to be resources at the county level. Nobody is going to have to be put on a waiting list. Clearly, that mindset has changed.
I think, I'm just throwing this out here for you because you're new to this group.
Yes.
Schedule some time with Melissa to really get into the ADRC, because I feel like we're like.
She's always on vacation. How can I?
She is not. She has never on vacation. She is never on vacation. That's why I was shocked when you said she was on vacation. But I mean, there's so much, you know, learning about funding sources. That would be good for you to just have a one-on-one with her.
I'll find some.
I'm fairly certain that she has presented the information that you're asking about and has it written down. So, you know, either Becky could send that information to you or to all of us, or, you know, somehow that can get to you, but we can't get all that today.
Yeah, I know, but I just just to recap, my point is.
Curious George, that is him.
Yeah, my point is, in the face of the reality on the ground, the idea of cutting funding, and possibly, may I suggest, if some of the state funding goes away for programs, actually increasing the levy funding in order to cover what the loss is to the state. The county can afford it, they need to do it, and I think
can't really increase the levy.
pardon me for putting it in a different way, but generosity gets generosity.
Yeah, I think-
In other words, things will come back around.
I think when it comes to the budget, it's really important to understand that even though we might have some money in the general fund, everybody is competing for it. It's not just the ADRC, right? So like there's all sorts of programming that wants money and needs more money, not just here. And I think that it might also be important to consider that we can't increase the levy because we have state regulations that have to be followed related to that. So I don't want to leave the meeting feeling like we have all sorts of money, because I would say that we don't. When it comes to the budgeting process, we're always trying to figure out who do we have to rob Peter to pay Paul type of a thing. So I agree with the idea that we don't want to cut services in this particular area for sure. But I don't want people to feel like we have tons of money, because I don't believe that that's true. But I will also say that I apologize. I have to leave in like 15 minutes. Can we go back to the agenda?
Just one thing, this is,
I agree with that, with not having tons of money. Don is right. Like me personally, I can't speak for the whole board. We don't have as much money as people think, but I can't speak for the whole board. But me personally would fight to keep funding with ADRC and HHS. But again, she is right. There is competing funding.
But the point is, there's 17 people, still 17 people on the county board. The voice is that perspective is shared by a number of people on the board. The folks who understand the needs and can be creative in the budgeting process need also to be speaking in the same sort of a tone that you are at this time. Yes, it's true, there's not an infinite amount of money, but you don't balance a budget by starving people. Okay, so that's the op.
Starve anybody as long as I'm on.
I was gonna say, I don't think anybody's starving.
Okay, but
just talking about
I'm
trends.
exaggerating for effect. Okay, that was a rhetorical device, which Dawn was also using, I have to say. So I'm just matching her rhetorical device with that.
Point
I
taken.
guess I just
point
want to,
taken.
before we move on, I just want to do a little shout out to our ADRC supervisor, Melissa. She has been in this position, I don't know, 5 or 6 years. And since she has come, she has really built this robust congregate meal site program. It's bigger than it's ever been since I've been here at the ADRC. She's just very good at navigating when troubles come up with the home delivered meal programs and she's super with volunteers. Like, she's just a real great person to be in this position.
And I want to shout out too to her and the whole ADRC.
Turn on your microphone.
Because you all worked with Western Dairyland and got the $100,000 grant to have the gym available to seniors at the Whitehall High School for free of charge. You can go and work out, and, I mean, you are right, Melissa has really expanded the program. There's so much going on, and with the, last week or last month, the former governor was here. I mean, there's just so much wonderful stuff going on, so.
And the one thing I will say is that by your next meeting, I will make sure that Melissa has more on-point information, like budget-wise and that
And
kind
I'll
of.
be in touch with her to.
Yeah, but I think that's a very good question, though, is to have a better understanding, for this group and kind of lay out some of that information, that would be helpful, so.
Speaking of programming, let's move on to nutrition.
All right, that's
Anything
me
new?
too.
Well, we've got several other members that are part of it.
Let's
They didn't have a meeting.
All right, so, right, there was not a nutrition council meeting. However, I do have, Melissa gave me the numbers for the congregate meal sites and home delivered meals for May and June. The July numbers are not completely entered yet. And I can do, does Melissa usually talk about them site by site or just in totals? Okay,
In general,
totals,
yeah.
gotcha. Okay, so congregate numbers of folks served in May, we served 1,217 meals in May at our 6 sites. And then in June, we served 1,076 folks at those 6 sites.
That's good.
And I'm not exactly sure, I think, there's obviously some fluctuations, but I think she's probably said this as well, too. The Cafe 60 model has been really well received, you know, where folks have choices, which, why wouldn't it be? You know, I mean, that's kind of, I think that's kind of becoming more of the wave of the future here, is to be able to offer that to folks, so. Home-delivered meals, in May, we delivered 1,480 meals. And that's on our 8 routes. And in June, we delivered 1,520 meals. So, and I'm sure she could probably speak a little bit better to like some of those fluctuations that happen based on the month or the time of year and that kind of thing. I don't have that information for you, so. But any questions about any of those that I may or may not know the answer to?
You have the supervisor report too, I'm sure. huh?
I do.
God, you're the star
You're like
today.
clairvoyance. Okay, so just a couple of things on the supervisor's report. Wanted to thank everybody who provided inputs and feedback on the nutrition program and then completed the surveys at the June meeting. We do appreciate that, and this is, and the reason why we've changed the timing between this meeting and the Health and Human Services Board meeting is so that this group, when there's feedback or when there's advocacy or whatever, it needs to be communicated to the Health and Human Services Board, that this happens before that meeting happens, because that's next Monday. So timing-wise, we really wanted to have this board go back to like, here's the advisory council, and here, Health and Human Services Board, this is what we're telling you and what we'd like you to pay attention to, so. We are currently working with our corporation council on the request for proposals for the nutrition program, which is expected to go out in September. So we are, we're finalizing those plans, I guess I'd say.
Could you just be a little more specific about what you just said?
Oh, sure.
Sorry.
I'm sorry, the request for proposals for the nutrition program.
Right.
So whether it's the congregate meal sites or the home delivered, I mean, both of those.
Okay.
So for all of the meal sites and the home delivered meal providers, we have to renew those contracts.
Those contracts in January?
Correct, yes. So we're gonna go through this process now. Yeah, yeah. Thank you for keeping me on task, Jean. Appreciate it.
No, I'm keeping myself on. Keeping myself to understand what's going on.
Yeah, so any other questions about those pieces?
Just one thing of feedback. I just think that it's unlikely that the community realizes, well, I guess what I'm trying to get to is that I would wonder if there could be any kind of publication that could offer or provide an opportunity for people to donate to the ADRC for nutrition programming and make it more of a obvious thing, right? Like, I don't know how many people know out there that that is a program that could use additional funding and could accept donations. So is that something that we could put out on Facebook or somewhere?
Maybe in
that-
the newsletter? Because we did get a hefty donation through someone's dying, and it was in the
Right.
Yeah, we've
will.
had several hefty donations, but we haven't necessarily been, like, to your point, Dawn, we haven't necessarily been out there with.
Right.
And if you'd like to support the county's, nutrition efforts for the folks who are accessing these services,
Right,
here's
and
how
I-
you can do it.
And I feel like the newsletter is great to reach the population that we serve, but I think there might be other people who don't require the services who would be interested in supporting it
Yeah, good idea.
as well.
I had made myself a note because as our discussion was going on, we talked about this last time or the time before about this program of donating and it's like, oh, whatever happened to that? So I'm glad you brought that up.
Yeah, and we do have, kind of going back to George's earlier point too, we do have a nutrition fund where we do have the donations and we have other funding as well that we've used to supplement so that we haven't had to decrease like our level of service.
I just think in
recently.
this period of uncertainty, it would be an especially great time to
Yes.
advocate for additional donations. And I just think of even a button out on the website, want to donate to the nutrition program, click here. Send out, flyers, that type of thing, so that if and when we do get service or funding cut, we may have some pot of money to work with.
That's a really good idea.
That's a good idea.
Yeah.
When I was in Arcadia at the meal, we were talking to some of the
Microphone.
people. Okay. Okay, when we were I was in Arcadia, I was talking to some of the people who
It's off again.
Let it turn red. Push the button, let it turn red.
Yep, you're
Okay, there
good.
we
Now you're
go.
on.
Anyway, I was talking to some of the people around the different tables, and their understanding was that the federal government just pays for this. We don't need to pay anything. If you give $5, it just goes towards extra. They really don't understand this. Right. So I just thought I'd mention that it was no one particular person. It was kind of a general consensus. So-
Is that a 503C whatever fund, that's tax deductible, or however that works?
501c3.
Right. That's, yeah, right, that's like nonprofit status. We could check in to see how exactly that might work, but,
Because I know some people that have to take, myself included, your RMD money, and you're doing your donation through that way, it has to be 503, whatever.
501c3.
Yeah, and so that would be, I have other friends that are in this same age bracket that would possibly do that, if that was available.
sure.
I'm sorry, but I have to leave that too.
Quite a few people have to leave, so.
Sorry, Scott. That's what you get for getting me on.
That's really good feedback, though. I do appreciate that. That's, and I'm trying to make myself some notes here.
Fund that no other part of the count, that
Correct.
money can't go for anything but.
It doesn't go back to the general fund or anything, right? No. It's a non-lapsing fund.
Thank you, I was gonna say
Yep.
non-revolving.
Just a few other short things, and the memory screens are now going to be conducted monthly throughout our communities in the county. In September, the event is going to be held in Trempealeau, in October in Independence. And then we're going to be putting those in the newsletter as well. I assume we'll have those on Facebook probably as well to remind folks. And those events are being spearheaded by our dementia care specialist, Tricia. So that'll be another resource that we're offering to folks,
You
so.
could put the thing that, what you were talking about, donations on the Facebook page,
Mm-hmm.
because that gets a lot of likes and people travel through that.
I'm right there with
Thanks,
you.
Beth.
See you, Beth.
Bye, Beth.
Bye, Beth.
Okay.
And then two more educational opportunities. Senior Medicare Patrol training is happening August 20th in Arcadia after the senior meal at the site there. And then safety and empowerment training and senior lunch pop-up is August 28th at the Trempealeau Library. Boondocks is gonna host the regular senior meal that day, but we'll also have lunch at the library.
How fun.
So. I just can't even keep up with everything that the ADRC is, like, I'm like,
Those
what
are,
do you mean,
those are
Melissa, you're doing
mentioned
that?
in
Okay.
this, so,
I was kidding about
as a
that.
reminder, yeah. Carry it with me everywhere.
Best ADRC in the state.
Yeah.
That's my opinion.
I'm pretty darn impressed. I worked with a lot of different ADRCs, especially when I was in the provider world and when I was in managed care. And there is no ADRC that does a better job than ours.
I'm very.
I know I'm biased, but I'm also speaking objectively as somebody who worked with probably a dozen different ADRCs.
Yeah, me too, and I'm very proud of our ADRC, very proud of it.
Yeah.
Because
So
they're
that's
gonna
all I
take
have.
care of me soon
Bye,
when I'm
Dawn.
old.
That's all I have, Scott, sorry.
Okay, thank you, Jay. Had a thought for you, Laura, as far as the distance between security and you guys. Just put up a sign that says, this is part of our Strong Bodies program, and we need you to walk. And
Oh, you're gonna have stations. Yes.
there you go. Yep.
Do 5 squats.
Informational booths on the way, and they could, yep, with a
I
chair.
didn't know we did program development here, too. That's
Yeah.
great.
It's advisory.
Are there any other open comments? Any scams out there recently that, bye, John. Thank you.
Bye.
I got a scam email yesterday from Amazon about something, and I was kind of ready to respond to it, and then a friend of mine said, don't, that is, because Amazon's not gonna send you an email saying something's wrong with look at your email, but I deleted it right away. So if you get something from Amazon, they want your information, just delete it.
Yeah, that's the other unfortunate part. So many elderly people that we go out to meet with are like, we can't even answer our phones because we get so many scam calls, like 20 or 30 of them a day. My phone just rings constantly, and it's always these unknown callers or unrecognized phone numbers. And it's people either trying to scam us or trying to sell us something, like, so they were like, we don't even answer our phone. So when we're trying to set up visits, you might have multiple phone calls between these people because they don't want to answer the phone, and you like leave a message, and then they call you back and they leave you a message, and so you play phone tag for a little bit.
Yesterday, I got a call at Amazon, and I said, I never ordered anything in Amazon, so click.
You got the same thing I did.
Yeah. I mean, it's just ridiculous. And my phone is ringing, and Tasha said, I think we should throw it out.
And and Medicare calls are starting to come now,
Oh,
and they
yes.
want your information.
Oh,
and-
yes.
Yep.
Yeah.
I never
Be really careful.
do anything over the phone.
I
If
need
they
to
want to
neither.
come and talk to me in my apartment, fine, but I'm never going to do anything over the phone because I said, you're nothing but a scammer. So click.
Need you to
Not you
answer my
guys,
phone
so.
calls.
I can't even repeat what my husband says on some calls. She's dead, he did say once.
Jeez. Had one gal at the Pigeon Falls Healthcare Center that she says, I'll listen to everything you want to say to me if you would just pray with me first. And they say, what? Do what? I said, just pray with me. Click. They hang up. So that's another option. Lori had mentioned there are three of you, Dana and Isabel. The staff are all listed on the inside of this Bible too, the ADRC Bible. So it's a good thing. Anything else? Next meeting, October 7th at 10:30 in this room, unless otherwise directed.
I'm going to tell you now, I won't be at that.
You have to be.
I'm going on vacation.
Oh, okay, thank you for letting us know.
Did you sell your cabin?
We sold our cabin and bought a little camper, which I call my mobile cabin.
How fun.
It's going on its maiden voyage.
Canadian?
Maiden.
Maybe.
It's never been used yet.
So thank you all for coming today. Thank you for your input. We're at the end of our agenda, so the meeting is adjourned.